HIV, AIDS and TB continue to be the most pressing health issues ravaging rural communities in South Africa. It is estimated that 29% of the population are HIV positive, while TB continues to be the leading cause of death. In the Eastern Cape province, where extreme poverty remains rife, more than a third of all people under the age of 60 are estimated to be living with HIV, TB, or both. As with many other conditions affecting vulnerable communities, many people suffering from HIV or TB do not know their status. This means they are not able to seek treatment and unwittingly put their own lives and those of their families and communities at risk. The Donald Woods Foundation, through its Health in Every Hut program, is committed to helping people find out if they have HIV and/or TB infection in the areas in which we operate, and ensuring that the affected can begin to get treatment.
HIV is one of the biggest problems in our community. So we make sure that when these child go out to screen and get to a person who's HIV positive, they make sure that they screen for TB, because it's an opportunistic infection and it's one of the biggest killers to people that are HIV positive.
HIV has caused a lot of orphans and vulnerable children. When we met a female at the age of 12 to 50, we do the pregnancy test. If the results came positive, we refer that client to the ANC clinic. When they are on the ANC clinic, they do the HIV test. And if that one is HIV positive, they give the ARVs, and then we check if the client is taking the ARVs well. And then after delivery, we check if the mother is still taking the ARVs and the child is taking the nevirapine. And then if the PCR is done to the child, and then we continue doing the follow-ups to the mother and the child. When we found at home the pregnant woman is HIV positive, we referred her to hospital to start PMTCT program. If is HIV negative, we refer her to start ANC. The embedded child from Ngatiana area found that family who was having 2 hypertension clients and then 2 HIV clients and 1 epileptic client. In that family, they were all defaulting their treatment. The embedded child referred all of them to the clinic.
Iipilisi ndandizithutha esibhedlele ndizitya. Kwathe kuhambeni kwexesha ke ngunana xa kuya ngokuba nami kwam iipilisi ezi angathi andibona umsebenzi wazo. Wabuza into okubana iipilisi zingaba ndisazisebenza okanye ngaba ndaziyeka. Ndathi ke mna hayi ndabona into yoba make ndiziphumlele. Wathi ke yena xa kuya ngobethetha nam uSisineliso wathi awunokwazi kaloku uziyeka iipilisi ngoba kaloku yimpilo yakho le. Ndavuma ke nam kwam wandenzela ke iphepha lonto yoba mandiye phaa emadwaleni. Na ufika kwam phaya ndafike ndaphinde ndamkeleka futhi into yoba iipilisi ndiyazinikwa ndiphinde ndiqhubekeke nazo. Nam kwam ndathi ngokuzibona kwam batyhene bendikade ndisinoba ndihamba apha endleleni ndiyaphepetheka ndibheka ngapha nangapha. Nasemsebenzini noba ndiyasebenza nditshayisa ngaphandle kwexesha. Ndathi ndizosebenzisa ezi pilisi ndaphinde ndazibona into yoba tyhene hayibo ndingulaa masibuleli benkade ndizazi uba ndinguye. Nam kwam ndizibona into yokubana noko ingathi ndiyakwazi unyathela nje uSisineliso wakho wandinceda ngokwelo hlobo.
And the lady was pregnant. She delivered and she didn't take her ARVs, and then she didn't get the nevirapine for the child, and the child didn't do the PCR.
Ndaziyeka iipilisi. Kwaso kwafika uSisineliso wathi mandihambe ndiphindele esibhedlele ndothatha iipilisi nditye iipilisi.
After we referred the child for the PCR, the results for the child came back negative. The mother wasn't taking the ARVs, and the mother wasn't giving the child the nevirapine, and the mother was mixed feeding.
Ndandikhulelwe ndabeleka ke mna umntana ke ndamtyisa ibisi nebele kanti bekuthiwe ke ndingamxubeli xa ndimtyisa ibisi ndimtyisa ibisi lodwa ndingamxubi nebele ndambiyekisa ibele ke ndamtyisa ibisi.
After mother come to hospital, we monitor the child to go to clinic every month for immunization. And if the mother is HIV positive, we monitor the mother to give the child a nevirapine. And every month must go to clinic to immunize and to monitor the weight of the child, if the child is growing up well.
Also, if there is an HIV involved, focus doing counseling. We concentrate educating teenagers in order they have to avoid contracting the HIV.
The advent of free antiretrovirals has given the DWF much needed impetus in delivering an effective management program for their clients, which includes constant monitoring, education around lifestyle choices and overall health. However, the challenges remain.
There is a strong link between HIV and TB.
Someone who is having HIV is at risk of getting the TB bacteria. The immune system becomes weak, and then TB bacteria get a chance to be active.
Ndiqale ngoSeptember uziva ngekho right, but ndathatha ngoba yifiva, yabona ke ifiva. Ndaquqa ekhemesti but ekugqibeleni ndanento ethi makhe ndiye ekliniki Stanford ndathatha. Emveni koba ivele iTB ndatya i-treatment ke ngoku. Ndicinga uba undincedile uDonald. Amantombazana akhona azamile ukundinceda, andithumela ekliniki. Ndaya ke ekliniki ndancedakala njengangoku uba ndisancedakele ngoku.
This is an extremely harsh environment with great distances between communities and facilities, and the clinics in particular. The logistical issues associated with HIV support are complex and intricate.